Welcome to this week's episode of Olsem Wanem. I'm Florence Jonduo. Papua New Guinea's tuberculosis or TB prevalence is rated the 10th highest in the world. TB is a public health concern in Papua New Guinea. Tuberculosis, or TB for short, is one of the oldest known diseases, discovered on the 24th of March 1882. TB is a serious public health issue in Papua New Guinea. According to the World Health Organization's Global TB Report 2015, the estimated TB incidence rate was 417 per 100,000 population.
Tuberculosis is a major public health problem in Papua New Guinea. However, this is a global problem too. So TB is one of the 10 highest killer disease globally and top infectious disease killer. In Papua New Guinea, the incidence rate, which means the new TB cases, the rate the new TB cases happen is very, very high, which is one of the highest in this Western Pacific region. Around 30,000 new TB cases arise every year in Papua New Guinea. And if we translate it into per day, which means that 80 people fall ill every day, and around 8 people may die of TB every day. So which you probably understand that this is a very, very big problem.
TB cases in Papua New Guinea continues to increase and is more concentrated in the southern region, with Western, Gulf and NCD identified as the 3 hotspot areas.
Status for TB in the country is basically there seem to be increasing at the moment. So far up to more than 30,000 given the population that we have, and it's more concentrated along the southern region and in NCD as well.
In 2015, the government of Papua New Guinea acknowledged the seriousness of the TB situation in the country and approved the National Department of Health's Emergency TB Response Plan. MDR and XDR-TB have risen to unprecedented levels and is considered a crisis in PNG, and scaled-up response is urgently needed.
In the strategy that we have, as I alluded to, we have the 3 hotspot provinces in dealing with the drug-resistant forms of TB. But the rest of the country is on the usual standard approach in terms of dealing with the care, with the drugs and the different care components to help get their treatment through. Now that we have going through establishing the 3 hotspot provinces and getting the strength in that, we are moving towards trying to branch out into the 4 regions of our country. So there's the southern region, and the southern region that's non 3 hotspot. So in the southern region, Western Province, Gulf, and National Capital District is the one that's already on the hotspot. But there's Central, Milne Bay, and Oro that needs to be taken care of or looked at, or the strategy will have to expand to include that. And then there's the Highlands region, and then there's the Islands region, and then there's the Momase region. And so that is one of the arms that will reach out to deal with the MDR-TB and get more focus in all those provinces, so that we get a strategy for each of the provinces to deal with the MDR-TB. In terms of drugs, specifically for TB patients, there are 2 different forms of drugs that we are mainly engaged in. Number one, the drugs for drug-sensitive forms of TB. This means that the TB can be cured. That's the sort of drugs that we have. That's the drugs that are available like anywhere in the world. And so these drugs are available in the country, but in a form which is much better than maybe in the past, when we had a whole lot of collections of this drug here, this drug, and then put together, you drink that. Now it's in the form of what we call fixed drug combination. So that means in the one drug are the 3 or 4 drugs that's required, and you just drink that 2 or 3, spare your weight. And so those sort of drugs are available throughout the country.
Government of Papua New Guinea established the National TB Program, and the TB treatment and care is available throughout the country through almost more than 270 health centers, and they also have more than 114 laboratories which helps to assist to detect TB cases. As Dr. Dakurala mentioned, that the TB treatment and detection is free of charge from the government of Papua New Guinea. And these drugs are quality assured and international standard. So if we all can detect TB cases early and go to the health center and be treated timely, then the TB problem can be addressed in this Papua New Guinea.
The TB response in the country has grown from strength to strength as many organizations join hands with the responsible authorities through partnership to fight the TB disease in PNG.
There are those partners that have come on board, especially in the TB space, engaged in TB, and they also came on board in the partnership. So, World Vision, it's a clear role is in how we mobilize down at the community level, the social mobilization for a response. But as well as that, they have been the ones mandated through the government of PNG and enabling funding for all of TB activities as per our strategy. So there's a lot of partnership that has come in on board as a result of the response over the years, and as the work had gone on and there's been more clarity or information that's gone out, more partners have also come in. And our hope is that through advocacy and continued work, there will be more and more partners who come in, specifically in areas where we may not be able to contribute as well. That's where they come in. That's their niche. They can come in and take their space and make a difference.
TB is curable and medicine is available in the country. The treatment period may seem long and painful. More on this when we return after the break. Tuberculosis is an infectious disease and it is curable. There are many misconceptions about how the disease is spread.
TB doesn't spread by, through sharing of food, eating utensils. TB doesn't spread that way. TB germ doesn't have legs and ends. It is a contagious disease. It spreads by air. And somebody who has TB that coughs can cough up TB germs, and anyone close to that person can actually get TB.
Treatment is available in the country, and the treatment period to fully eradicate the TB germs is long.
And TB treatment is, for the drug-sensitive TB, is 6 months, and for the drug-resistant TB is 20 months. So some can go a bit more than that. So it's a long treatment, and many people when we start on treatment or get them on treatment, they feel better after 3 weeks, after 1 month, after 2 months, and they think they are cured already, and which is really a false assumption. What we expect them to do is really to continue their treatment until they really complete their treatment and they are declared cured or treatment completed at the end of their treatment. So that's one thing that we have noticed is after 3 weeks, people get better with treatment and they tend to stop treatment on their own.
The consequences of TB patients not completing the medication of the first-line drugs or drug-sensitive TB is the risk of developing multi-drug resistant TB.
Looking and tracking the TB situation in NCD, we are finding that in terms of treatment and cure rate, how many patients that we actually successfully treat, we are not reaching our target. And one of the strategy that we have adopted as part of our 5-year plan was to recruit treatment supporters. And we are now running the NCD community-based TB treatment project. And this project is going to run for 3 to 5 years. And some of the strategies in that project is to recruit treatment supporters. These are people in the communities that will help that will help the TB patient. They will support them, make sure that they are swallowing their TB medicine. They will follow them from the time the TB patient is registered to the time that they complete the medicine. In that way, we can have some assurance that the TB patient is now going to be followed up from the time they are diagnosed to the time they complete the medicine. So we are now dealing with the issue of defaulter.
There are other social determinants that contribute to TB patients not completing their treatment.
They are not able to, like food, for instance. They tend to think that if they don't get enough food, it's best not to get the treatment. Until they get their food, they will take their treatment. But all these contributing factors, and some of them accessibility, traveling from like bus fares, and some of those patients, they are not able to afford bus fares, are not able to reach the nearest clinic, issues like that. But that gap, we really want to help reduce that gap, like helping TB patients, facilitating their travel and all that, particularly in the drug-resistant TB. So our partners, NCD Health Services, World Vision, through Global Fund support, want to help to minimize as much as possible those factors that prevent them from TB patients from completing their treatment.
NCD Health Services, together with their partners, have come up with strategies to address the high rate of TB patients defaulting.
World Vision FHI 360 Child Fund has already recruited over 160 treatment supporters in the city. They are now working in the settlements following TB treatment. The other strategy is to provide bus fares and also food vouchers. As Dr. Moka has mentioned, TB patients need to have good nutrition in order to respond to the treatment and to get better faster. So as part of our strategy, we will be giving bus fares for our patients, both drug-resistant and drug-sensitive TB, as well as give them a food voucher every fortnight. I think this is around 200 kina that we give them, and they will go to Stop and Shop and get food, and that's to help them.
Challenges are vast in addressing the treatment of TB in Papua New Guinea.
It's a huge logistic challenge that we face, and so when we are talking about treatment that's made available to all these 270 plus sites that we are talking about, it's not easy, and so that's a big challenge and obstacle. In our country, health systems have gone down over the years. We are working very hard through our government's directions to ensure that the systems are brought up to a level where we can function, and so standards where we can function. So a lot of what happens in terms of the TB treatment and care is carried out in such a setting, and so there's great difficulties. And sometimes we face those challenges in terms of getting availability of drugs to those settings. And then, of course, there is a challenge of the workforce. The numbers who are trained well or who are appropriately trained, who know about TB and dealing with TB, and the numbers are an issue, and it's everywhere in terms of the health sector and the workforce. The numbers are very, very low, so it's an urgent situation that we are working on to ensure there are enough workforce to be around to deal with the TB issues.
After these short messages, we bring you highlights from the World TB Day commemoration in the nation's capital, as well as a TB patient's testimony. The National Capital District commemorated the World TB Day at the Sir John Guy's Indoor Complex, which saw participation of students, various NGOs, government arms, and the general public. It was a day to create awareness and educate the people about TB. There was also a patient testimony. Here is Morea Aubo's story.
Being a MDR-TB patient myself, it's a very, very bad thing that I would like to share my experience. I'm discriminated by my own wife, my own family, and my people. I'm a councillor for 10 years at Manuman. 10 years councillor. I'm an accountant by profession. I've been working for many years as an accountant, but when I got this sickness, all my good friends ran away from me. They're very scared to see me. They're very scared to associate with me. And to make it worse, I cried because my wife really discriminated me. My children. I was just treated as somebody strange. I used to cry. For TB, I just don't want to talk about TB today because it makes me upset. A man deserves to get what he plants. Because of prostitution, men get AIDS, women get AIDS, because that's the penalty. The penalty that they are playing around with their bodies, they deserve to be AIDS infected. As for TB, it's an innocent man, innocent doctor, innocent nurse, innocent human being. When you are around with TB people who are not treated. Why it's an airborne disease which is very hard to cure. Even doctors, when I question them, how are you going to help this country with this disease? It's very difficult. It's an airborne disease. Anybody can cough here who's got a TB and it just fly around and then somebody get it. And here we are infected with TB. I was diagnosed for TB and then my family said I was, somebody got my bitumen skin and they were going to refer me to poor people at home. And my doctor told me, if you follow them, you're going to die. If you follow me, you will live. Trust me, TB is curable. So I told him, doctor, I will live with you, and I will die with you. I will follow you. Me, I want complete 8 months injection. Every day on one side, for 8 months. If you calculate first region 1, 6 months and 20 months, I completely have about 11,000 tablets and how many injections I got. Calculate 30 days times 8 months, daily for 7 days. But life is very important. You are sitting around breathing and thinking and you are smart, very smart and good. But when you come to sickness like TB, you find that your lungs are failing, you can't breathe because one is pumping, one is not pumping, and you see life is very important. Life is more important than money, gold, and silver. To fix yourself, how to fix myself is they call it adherence to medicine. If you keep your medicine, if you are adhered to your medicine, you take, you drink, that's okay. You tick, you don't do it, that's okay for you to, because you will die. The penalty of 10 lives is death. I'm living and talking to you because I know life is one only that I am living. And to play with it and tell lies to myself is nobody's problem. It's only my own problem, which is my graveyard. I got my medicine on time, I got everything. It's very painful exercise, but I managed to complete it. I completed on the 21st of February this year, 2018. So my encouragement to tell people is, it's curable. Have confidence, get your medicine, it's curable.
After the break, we hear some important messages from relevant authorities and how we can work together to kick TB out of PNG. The 2018 World TB Day theme is Leaders for Ending TB in PNG. The fight to ending TB in PNG is everyone's fight. Together, we can end the TB epidemic in our country. Here are some messages for us to take note of.
Please be part of the leader to have this TB-free Papua New Guinea. Let's act now, and we all are the part of this solution.
As you know, the global theme is Leaders for TB-free World. We want people to come and learn about TB so you can go back to your community and help at least to educate and also provide some leadership at the community level to help reduce the number of cases so your friends and family members do not become victims to TB.
Just to bring to our attention, in any hospital you go in PNG, the leading cause of admission is TB. The leading cause of death is TB. TB, more than 50% of any admission in any hospital is TB. That means we still have TB in the community. I would like to say that be a leader, be somebody who can do something about TB. And be more proactive.
Well, there's already a concerted effort that's now come about, and it's a good opportunity for us to all come on board and find our place and engage. And this is as leaders at all levels. Leaders not just at the highest level, but in the community, up at the local level government setting, very, very important to be engaged. Leaders at the provincial settings or levels, and then at the national level, both in the central agency of government, but also in the political leadership. When we all come on board and take TB as an agenda that we can all help to make things happen, then we will see progress. But as well as that, for people who have TB, there's treatment available, and it's free. And you can get yourself to a place where you can get a diagnosis and then stick with the treatment with someone who can help you to follow you up until you get a cure. And that simple, straightforward action, as we do it step by step, it goes a long way to helping eradicate TB in our country. Let's kick TB out of PNG. Let's kick TB out of National Capital District. Let's kick TB out of Gulf. Let's kick TB out of Daru, Western Province. Let's kick TB out of PNG. And the time is now. We act now, we'll make a difference.
And that's all we have for you this week on Olsem Wanem. Remember, TB is curable and medicine is available in the country. Until next time, if you have any comments or stories you would like to share with us, please send us an email via the address now showing on your screen or visit our Olsem Wanem Facebook page. Until then, I'm Florence John Duo on behalf of the entire Olsem Wanem team. Thank you for watching, and it's goodbye for now.